Dear aquarist, speaking about fish diseases is sometimes done from a vacation place, not always being in Belgium, sometimes being abroad and enjoying some vacation. Here you see the background. Well, it's a photograph of Casares in the south of Spain in Andalusia. And today I will discuss with you the fish disease case number 71, which is about a lionhead, adult Oranda lionhead, which had a mix of infections. I will show you in my examination, and had the development of tubercles in the inner organs, which are most likely could be fish tuberculosis. Only a laboratory can confirm this, but I will show you my findings in this case here. Well, the lionhead, here you see the photograph of it. You can see some red markings on the side here of the fish. It looks very nice in body, but he had some extra fluids in the abdomen and some raised scales. So some reddish areas, which was of course showing that the fish was in distress. And then you can see it here in the behavior. The fish was dying. You see the difficult respiration. You see the red markings here. So the fish is, well, it was in bad shape, and that was the reason why we were offered to this fish for an examination. The first thing we did, like we always do, is taking skin scrapings. And here we see the skin scraping with parasites, Ichthyobodo or Costia, that used to be called. So it's quite a few. So this, of course, this parasitic infection was, of course, making the fish suffer more and more during the time he has this serious infection. Here we see another part of the skin scraping. You see the massive amount of flagellated parasites, which are causing a lot of harm to the fish, and that needs to be treated. Also the gills, we found some gill flukes. There are quite a few on certain gill lamellae here on the gill filaments. You see quite a few here. That's, of course, this is a second infection we found on the exterior of the fish, one on the skin, one on the gills. And then we started to dissect this around the lionhead. Here we see the air bubbles, the gas bubble, how you can say the gas physical swimming bladder. It's another name for it in different languages. Here we see already a part in the middle of the kidney sticking out. You see some reddish liver. When you remove the swim bladder, we see a very large, thick kidney on the dorsal part of this fish. And you see the reddish part of the liver. And a lot of fluids in the abdomen, which was not normal, because so much fluid is not normal. That's why the fish was a little bit bloated, you can say, so in the abdominal cavity. So we start checking on the organs, and the first thing we said, checking the kidney, and we found those tubercles all scattered around and taking away healthy tissue. So that makes the kidney working in very poor condition. And also the liver was very reddish. Also, we have lots of tubercles. So the liver was not functioning properly at the same time. So our conclusion and suggestion for treatment for this around the lionhead is that, of course, when the fish is suffering so badly, you should put the fish asleep. It's no use that you keep this fish longer in the fish tank. It can only be a continuous risk of spreading diseases to the other fish in the fish tank, and the fish is suffering. So why not better euthanasia, put it to sleep? There are different products for that available, like Narcomore Plus from Aquarium Münster can be a good help to put your fish gently asleep. Many of the fish in that batch where we found it might carry tuberculosis, which is most likely the tubercles we found. And if you see scientific studies, about 85–90% always show that it's Mycobacterium. But some of the fish can survive a very long time with this bacterial infection, this Mycobacterium, even sometimes for a lifetime, depending on how well the fish is kept, in what good conditions he has been kept, what good of feeding program he has been getting. And sometimes the infection is very small, so he can survive a long time. That you don't know, but the fish will tell you in its behavior and its eating pattern. But of course, due to that kind of internal bacterial infection, tuberculosis, there is a risk of secondary infections with parasites, like we've seen here, the Ichthyobodo and the Gill flukes, and that you can treat with products which are common available in the pet shop or from your veterinarian. You can help your fish during that time with a food that can guarantee to give you a better outcome. So the fish is stronger and survive longer. And we recommend for this our specially developed Dr. Bassleer biofish food Fuco, which is with fucoidan extract, or the professional treat which has a mix of herbs and nutricaments that help the fish to do better, to recuperate, and to cope with many problems, particularly to heal himself. So only give that food, no other food. And at the same time, check the sources of the fish, because usually this fish comes from a source where the mother fish are the ones that are spreading the disease to the babies through the eggs at the breeder's facility. So this was my case of the disease on a giant adult lionhead, which lived a long time with this disease. And I leave it up to you to use this information to stay in control of your fish diseases. Wishing you all the best. Thank you.